Terrific. Come sit down. Dr. Nestle, Dr. Kessler, hello.
Good afternoon.
So I am Mary Beth Albright. I am the on-air food anchor for the Washington Post, and I am so honored today to have two titans of the industry with us here at Washington Post Live. Dr. Marion Nestle, Professor Emerita at NYU and author of several books on food politics, and Dr. David Kessler, former FDA Commissioner. Dr. Kessler is also a pediatrician, also a lawyer, and author of many publications on nutrition as well. And today we'll be examining the role of chronic disease and the role that chronic disease plays as a driver of healthcare spending, and discussing how preventive care and lifestyle management measures tied to proper nutrition can lower costs. And if you have questions, as before, you can tweet them to us using hashtag Health202. So let's get started. Okay, look, so trillions every year are spent on chronic disease, on rising healthcare due to chronic disease. And in 2012, half of all US adults had at least one chronic condition, and 86% of healthcare spending was for patients with at least one healthcare chronic condition. These numbers have to be able to be reduced, right? And so your work has been spent on figuring out how we get to this, to the nexus between chronic conditions and healthcare spending. And so my question for you is, if you were able, because you also study policy, and if you were able to have one or two policies that you think, and no holds barred, nothing in your way, if you were able to have one or two policies that you could make in Washington, D.C. about healthcare, chronic disease, reducing spending, what would they be?
Well, the first thing, on the macro level, I would link agricultural policy to health policy and set up an agricultural system that produces foods that are healthy for us. On the micro level, much better food for schools and much better food for child care institutions, with a lot of support for that. Universal school meals, absolutely.
Sounds like you're talking a little bit about the Farm Bill.
You can't not talk about the Farm Bill.
Yeah.
You cannot not talk about it because the Farm Bill is set up to do exactly the opposite of what it doesn't involve health care at all. And the agricultural policy has to take health policy into consideration if we're going to have dietary approaches to prevention of chronic disease that work. We have to have fruits and vegetables cheaper for people, more readily available, so grown in places where we're now growing. We don't grow food in this country, we grow feed for animals and cars. And we need to change that and grow food for people that's going to make them healthy.
I have a quote from you. I've been reading up on you.
Oh dear.
Of course, right? Agricultural policy in our country is not only hazardous to public health and the environment, but also to American democracy.
Ah, yes.
So you know that quote.
That sounds like something I would say.
Yes. And we just had two members of Congress with us. How do you connect that?
Well, they're talking about a healthcare system that doesn't work for most people in the country, and both of them admitted that. And if we're going to if we're going to lower healthcare costs, we have to have healthier people who don't use as much of the healthcare system or need as much. And the way to do that is through lifestyle changes that involve, oh, it's so boring, diet and exercise, and that's the problem. It's boring.
Well, Dr. Kessler, you've done so much research on the brain and how the brain reacts to food and how companies work with the human brain to have it react to food. What would your policy be, or any other reactions to Dr. Nestle's comments?
First of all, I think the problem is worse than we think. The more I study the effects of obesity, the real metabolic chaos that ensue in our bodies, I am struck. There are diseases that are not even listed on the CDC website that I think are associated with obesity. And yet, I think the answer, I think if we're honest, is we have no solution. We are clueless as far as what interventions work, right? I'm not sure I know what to eat. I mean, I walk into an airport and I see there's nothing, if I'm hungry, I can eat. And I think we have failed in giving nutritional advice to people. If diet and exercise were the answer, we'd all do it and there wouldn't be a problem. It doesn't work in the long run. I could talk for hours on what's stimulating us, what got us into this problem over the last several years. But I would go back to the basics. We spend literally billions of dollars throughout many different departments. I would go back to the very basics. I'd set up a national in the National Institutes of Health. I know, we try to avoid setting up new institutes. I think it's time to set up a National Institute for Nutritional Sciences. I would try to get answers to very basic questions. Is a calorie a calorie? Right? Can I eat unprocessed meat? What's the basis of insulin resistance and diabetes? What's going on with my brain? I think we have failed the American public when it comes to giving them basic information.
When you say we, do you mean the government? Do you mean the media? Do you mean
The food
physical
industry?
science? Do you mean science? Do you mean the food industry?
The food industry?
Do you mean corporations that create food? Do you mean all of these?
I think we've created foods. I think we began processing foods in the 1920s, 1930s in order to feed a hungry nation, to be able to ship foods longer distance, safer foods in some way, foodborne illness, reduce costs. And I think no one has a clue the effect of processing on human physiology. Something has driven all of us to get bigger and bigger. And we're leading the world and we're exporting it. And it's coming from what we eat and we don't fully understand it.
Yeah, I'm not sure we have to fully understand it. I mean, we know that the United States agricultural system produces about twice the number of calories per capita that the country needs, and those calories have to be sold, and that people started eating more. Starting at about 1980, people started eating more calories, and the number of calories consumed increased per capita by somewhere between 300 and 500 calories a day, and people gained weight. Not complicated. Some of that came from larger portions, and some of it came from food marketing, and just pushing food absolutely everywhere. If you eat more, you're going to gain weight. I think we know what healthy diets are. They're diets that contain a lot of fruits and vegetables, balanced calories, and don't contain a lot of junk food.
So why don't we do it?
We don't do it because we're being marketed to the tune of billions and billions of dollars a year in every possible way and in every way that you described in your books about the way that marketing reaches us in ways that we're not conscious of. So we're not even aware of the way we're being encouraged to eat more all of the time.
So don't you think that if there's that kind of money being spent on research by corporations, that it would behoove us to spend that kind of money on prevention, and that perhaps we have spent money on looking at prevention, because obviously prevention is less expensive than trying to treat these conditions, and maybe we haven't come up with how to prevent or how to circumvent whatever advertising is coming at us?
Well, there are actually quite a lot of studies about interventions that work. I mean, those are really interested in childhood obesity as the place where people are really concerned about it. And if you put restrictions on marketing to children, that works. If you have better food in school, that works. Soda taxes reduce soda consumption. I mean, there are a whole stream of policies and catalogs of them that, when implemented, help individuals reduce consumption of the foods that make them gain weight.
So Mike on Twitter asks, is there anywhere you won't cross in the quest for... I'm sorry, I don't quite understand this question. Let's go on with the conversation. I'm trying to understand what Twitter. So when I have sugar and fat in front of me and I'm trying to control that part of my brain, Dr. Kessler, one of the things that you've written about is that you have seen people on weight control drugs such as fen-phen, and they literally they will say to themselves, this is the first time I've ever felt normal around food. This is the first time I've ever felt like I could control myself around food.
It was highly effective. It worked. It shut off appetite. We don't fully understand.
And it was profound.
And it certainly acted on those neural circuits, and it was profoundly dangerous. I mean, think about it. I mean, first of all, so what are the circuits that are involved in eating? They're the learning, memory, habit, and motivational circuits. Right? Those are all, if I'm stimulated, that chocolate chip cookie is here and has power over me, right? That's because of past learning, habit, motivation. Those circuits are the ones that are being affected. I can quiet down those circuits, but what happens if I quiet down those circuits? What are those circuits necessary for? They're not necessary just for eating.
Yeah, right.
So you're going to have to give me back 5 or 6 IQ points if I quiet those circuits. Right? So that's why, I mean, I just went, I was at the American Gastroenterology Association, and the answer there was just drugs and more devices and more surgery. Mm-hmm. And in part, I mean, that's out of frustration. I mean, that can't be the answer. Mm-hmm. Long term. But the reason why they're back against the wall is because they don't have effective solutions to shut down our appetite. What's gone on that stimulated our appetite so that we can't stop?
Well, but I mean, the real question is what happened in 1980? That changed. Genetics hasn't changed since 1980, but people are eating more. What happened? I would say 3 things happened. We overproduced food to a much greater extent. That food had to be sold. The shareholder value movement on Wall Street meant that food corporations, like all other corporations, not only had to make a profit, but they had to grow their profit. And we deregulated a lot of controls on marketing.
Can I answer, Marion?
Yeah.
We took fat, sugar, and salt. We put it on every corner. We made it available 24/7. We made it acceptable to eat anytime. Right. Right. Mm-hmm. We not only made it acceptable to eat anytime. I mean, walk in to any place to eat. It's the way I have a good time. I can unwind. I can feel good, right? Mm-hmm. I mean, we created, what did we expect to happen?
If you eat more, you're going to gain weight.
But why do I keep on eating? There's something that's stimulating me to eat, that's driving me to eat.
Well, what changed between 1980 and now that didn't happen before 1980 when the prevalence of obesity was much lower than it is now?
Well, you had the McGovern had his report what year?
77.
And what did that report say?
Eat less.
No.
Yes.
No. If you read that report,
Eat less sugar, eat less fat. The assumption was that calories would go
no,
up.
if you look, it said eat less fat, eat more carbohydrates. If you
But
read
eat, less,
that report,
but eat less sugar.
right. But it said eat more carbohydrates and substituted carbohydrates. We're clueless on what's going on.
Right, but where we are now is that 7 of the top 10 causes of death are from chronic disease. And where we are now is that we're spending trillions of dollars in healthcare on chronic disease. That's where we are now. And so what do we do about that? Where we are now? I mean, what is the intersection between corporate health and public health? Because you have these corporations that are now built into the system of the way things work. We have a public health that is some people say in crisis, and we have a media who's trying to give people information, and we have you two who are scientists and experts help us understand what to do about this. Some people call a crisis, about the rising cost of healthcare due to chronic diseases.
We have to get very serious about nutritional research and take it up in quality. We have to figure out better methodologies. We have to understand our physiology so we can shut down or quiet down our appetites without simply drugs and extreme surgery.
And food funding, nutrition?
I would say we need some policies that deal with the way food is marketed, produced, marketed, distributed, and sold. That we need some policies to deal with that. I think lots of I talk to a lot of food company executives, and they all want to be part of the solution. They don't want to be part of the problem, but they've got stockholders to please.
And there's food funding in nutrition research that you're not so happy about.
Well, there's corporate funding of nutrition research that I'm not so happy about, right, because it skews the way the research comes out, and the alcohol study that just got shut down at NIH.
So how can they be part of the solution if...
They can make different kinds of products and market them differently. And they're looking at ways to do that. But at the same time, they're caught because they've got stockholders to please.
Sure.
The fact is, there's something in the way we've been processing food, right, makes that food so highly absorbed so quickly. I mean, in essence, if you look at, food is so highly processed, it goes down in a whoosh. I mean, it's like we're all eating baby food. And it gets absorbed so quickly, and you look at the physiological consequences of that, right? I mean, they're profound.
We haven't even gotten to, we've been talking a lot about the chronic health issue of obesity and eating and excess alcohol. We haven't gotten to the chronic issue of loneliness and depression. And the immediate former Surgeon General has taken that on as his public health crisis. And how that factors into lifestyle problems, underactivity, overeating, overdrinking. And so I wonder, we have a minute left, but
let's solve these.
So let's talk about, so let's solve the issue of depression. But I do think that it's worth mentioning, and I wonder if you, before we leave the stage, have any advice to the people in this room in various walks of life, and particularly to the media, about the way that we cover things.
I would say food is one of life's greatest pleasures, and you don't want to lose that in anything that you do. We have a lot of problems in society. Food connects to an enormous range of problems in society. That's why it's so important, and I think it's great we're talking about it.
Some of the neural circuits, and I know people will not, it doesn't come naturally to think about this, but that chocolate chip cookie has power over me.
right? I start thinking about it, it becomes front of mind. Right?
Yeah.
Well, I can't shake that. Well, what's depression? What can't I shake? Right? I'm a failure. I'm no good. Right? Things are not going to get better. What becomes front of mind? I mean, they're actually, they're both, they can be very salient stimuli. And I think, I mean, in the end, I mean, we need things that are better. We need better food that's going to capture us. There's going to be something more than that chocolate chip cookie that I want. It's going to be, it's hard to get there. But there's something more than hopelessness. And I think, I don't want to get the rancor, the anger, the political, partisan, we need people who inspire us to give us hope, to the better angels. You want to, I mean, you know, there are going to be people who are lonely, but you know, this has profound effect on what we're doing in this town, on our mental health. And mental health that affects all of us.
Thank you so much. I wish we had more time. Unfortunately, that's all the time we have for today. Thank you, Dr. Marion Nestle. Thank you, Dr. David Kessler. Always a pleasure to see you. And this time we will move on to the next panel. Thank you.